Good morning, everybody. I'm Chancellor Donde Plowman. It's been a busy first week as we've welcomed our vols back to class and worked hard to get used to the new measures we've put in place to protect the health and safety of our community. I appreciate everyone who is working so hard, wearing their masks, even outside when they're with other people and can't social distance. It's hard, but we can do this together. I know we can. I'm joined this morning by Provost John Zomchick, Dr. Spencer Gregg, head of our health center, Dr. Kathy Brown from our Department of Public Health. Dr. Brown is the program director for UT's Master of Public Health program, formerly an epidemiologist at the Knox County Health Department, and she's helped put our campus contact tracing program together. And she and Dr. Gregg are going to help answer some questions about contact tracing today. So today on the agenda, we're going to do 5 things. First, I want to talk about the data related to our case counts. Second, I want to talk about the notice I issued yesterday as it relates to gatherings off campus, on or off campus. We're going to have an update from the provost on how classes have gone and how the technology is working. And then we're going to try to answer some questions, have a discussion around contact tracing. What is it? How it works? Why it's so important? What does it mean? What's private? What isn't? And finally, I have a direct message to the students I want to close with. So let's begin with the data. So as we pull up this graphic, I want to remind you and reiterate that this information is on our website and it's updated every weekday morning. And let me also say that, remember, these are the numbers as of last night. So currently, let's look at our chart here. Currently, there are 110 active positive COVID-19 cases on campus. Out of that, 103 of them are students and 7 are employees. You see that flat line, flat to slightly declining line on the bottom are employees. So just a little context to put around this. I look at this and I'm going to ask Dr. Gregg in a minute to calm me down. I see the curve looking like it's bending a little bit, but I don't want to get too excited there. We have 103 students, active students, and I want to remind you that we will be announcing shortly our enrollments are probably over 30,000. So Dr. Gregg, when you look at this line, these lines on this graph, what do you see? What does it tell you?
Well, I guess the signal it sends to me, first of all, is that our employees are doing a much better job than our students are of flattening their curve. We did expect that when students return to campus that these numbers would start to go up and would anticipate they may continue to rise a little bit. But there's no reason why it should continue to rise as long as students are adhering to the health and safety guidelines that the university has put out, specifically as it relates to avoiding gathering in congregate settings with other individuals, keeping your mask on when you are around others, and maintaining that physical distance of at least 6 feet away from other people. That's what those employees, that's what that blue line is doing. And that's why you see it flat and why you don't see the other lines flattened at this point.
Okay, so talk to us a bit about you're administering testing. So talk a little bit about that. So we've got 103 cases. How many tests are we performing? How does that compare to our capacity? What about the test turnaround times? Talk a little bit about testing if you could.
Well, initially, as students were just arriving back on campus, we were averaging somewhere around maybe 6 to 10 tests a day. Since classes have started, we're averaging more around 15 to 20 each day. That compares to a testing capacity of potentially up to 2,000 tests per day. Our capacity to test is really going to be limited by our ability to see patients and collect the samples. So I don't know that even with our staffing, we could fully collect the full 2,000 samples, but we could certainly do much more than we are right now if it's needed. Our average turnaround time on test is about 24 hours here over the past 3 or 4 days.
Well, that's good to know because we hear a lot in the media about 7 to 10 days, 3 to 5 days. So that's really important for everybody on the call to hear, 24 hours. So thank you, Dr. Gregg. So let's look at the next graph that's on our website. And this one is about the number of cases of quarantining, self-isolation. So let's look at the graph here, the bar graph here on the far right for today. We now have 408 people in quarantine or self-isolation. Right now, I'm just using those terms interchangeably a bit. Of those, 327 are students. So what you will see over here is the blue and the green total together are 327 students, and the brown part is our employees who are self-screening. So what we see here is the large majority of our students who are self-screening are non-residential. And that makes sense because the large majority of our students, out of 30,000, 6,500 of them live in the dorms. So of the 6,700 living in the dorms, 87 of them are self-isolating. I could break that down even further. The majority of those are not self-isolating in the rooms we're making available. Some of them are able to go home and that kind of thing. So let's look at that tells you where we are with self-isolations. Now, there was a big uptick in a way between the 17th and the 18th in self-isolations. And I would say, what that says to me is students are doing what they're supposed to do, taking the temperature and self-isolating. So I think that's a good thing. Let's look at the next graph, which is the graph that tells us why are people self-isolating. So look at the biggest factor is because 43% of them have either been identified as a close contact or think they are a close contact. 27% have begun to develop symptoms. I'm guessing most of them have been tested or in the process of getting tested. And 21% of them have already had the results of a positive COVID test. That 9% over there, other category, those could be reasons like maybe somebody traveled to a place where they shouldn't have, or that has a really high rate, and they're self-isolating, and we congratulate people for doing that. So that is a picture of why people are self-isolating. So you can look on our website, the coronavirus website, and it'll give you much more detailed information about that. So let's just stepping back from this now, as it relates to these numbers, is there any information here, Dr. Brown, I'm going to go to you for a second, that surprises you? And Dr. Gregg, you could weigh in on this as well.
That surprises me about the self-isolation and the numbers? Not really at all, because when we bring together large numbers of people who are coming from lots of different places across the country, from within the state, people are coming from areas that either have they're in a hotspot themselves, it's only likely that we would see an increase, making it even more critical and important to execute all of the protection and the guidance on distancing and masks and so forth.
Dr. Gregg, is there anything that you're going to be looking at as you look at those numbers? I know one of the things I'm looking at is I'm really happy to see that faculty and staff line flat. We've done a lot of work to keep our faculty safe. We are dependent on our faculty and staff for delivering on our mission. And so I'm going to have my eye on that really, really closely. But what else are you looking for, Dr. Gregg?
Well, certainly, I think that we would anticipate to see more positive tests amongst our student population because they're the greater population. They outnumber our faculty and staff. But if they're adhering to the safety guidelines that we put out, then that curve that you're seeing with them, it's going to be higher, but it should be flatter. And so by that curve not being flat or beginning to flatten, it tells me that we're still not adhering to what we need to be doing as far as social distancing, those kind of matters go. And it is concerning to me that we see a large number of these being students that reside off campus. Yeah. And I would just say that whether you're on campus or off campus, all of us depend on you doing your part to keep all the rest of us safe. just if one person tests positive, that's potentially 3 or 4 more people or even more that have to go into quarantine. And so that, I think it's key to getting both our isolation and quarantine housing under control, and to keep it under control, and to keep down the incidence of positive cases on campus, is to follow that health and safety guidance.
So thank you very much. Let's go to my second point I want to talk about, and that is yesterday I sent out a notice on campus to be really crystal clear about student conduct around social gathering, either on and off campus. And if you were on the last call, I made some very stern comments, which I do not take back in any way at all, about what we expect of each other. And so yesterday, when I was out and about on campus, I went out to lunch, kind of drove through the campus. I was really heartened to see people wearing their masks and social distancing. Somebody said, well, why are people supposed to, on social media, they're supposed to wear them outside? What we've said is in classrooms, in public spaces, and outside when you cannot social distance. So basically, if I'm outside by myself and there's nobody around me, I don't feel bad about taking my mask off. What I saw yesterday was groups of students walking together, looking like they're having a great time. They had their masks off. I've heard of other people tweeting at me saying, I saw the same thing. Now, at the same time, I get the tweets that there's somebody who's not wearing a mask. And what I say to people is just walk up to them and say, hey, did you forget your mask? It doesn't have to be a big confrontation. I've got an extra one here. But I want you to know, I know this is hard. But I also know we are volunteers and we can do this. Volunteers have always done things for the greater good. And that's where we're at again right now. So it won't be forever. The vast majority of our campus want us to be able to maintain an on-campus experience. We made that commitment. We've worked so hard for the last 5 months to do everything we can to keep people safe. And now we're asking students to help join in that effort as well. But COVID doesn't take, just as Dr. Gregg said, it doesn't take very many people not following the safety measures for it to spread and then screw it up for everybody else. So yesterday, I sent out a notice to our students about how we will use our code of conduct to hold people who host gatherings and parties where people are not wearing their masks and they are not social distancing. We will hold them accountable. And it's very clear in our student code of conduct that we expect people to respect, maintain, preserve, and work hard at maintaining the safety and health of everyone. It's in our code of conduct. So I know our students can rise to this challenge no matter how difficult and light the way for others. I know that we can do that. So let me just switch gears for a minute and ask Dr. Zomchick, our Provost, Chief Academic Officer, can you give us a quick update about just how the first week of classes went, what you're hearing, classrooms, faculty, and then we'll talk a little bit about contact tracing.
Happy to do that, Chancellor. We're continuing to outfit our classrooms with technology because of some supply chain issues. We didn't get it all finished before the first day of classes, but currently we have about 200 of 235 of our classrooms fully outfitted with a basic technology package of a web camera and something called a sign app, which allows faculty to attach up to four pieces of equipment to use in the classroom. We're also continuing to provide support for faculty through our fantastic Office of Information Technology and the people that are working there. We've offered faculty, for example, opportunities to have classroom producers, typically students who can help them manage some of the technology in the classroom, or Canvas producers if they're teaching virtually, those who can help them fill out their Canvas website. Our Canvas is our learning management system. Yesterday, for example, I was spending a little bit of time in the student union handing out wellness kits to our undergraduate students, all our students really, who haven't gotten any yet. And I just happened to walk down the hallway into the student union auditorium. And there, one of our faculty members was getting ready to give a class on Renaissance art history, and was having trouble with the projection. And within a matter of minutes, there was someone who showed up and solved those problems, and his slides were up on the screen and he was ready to roll with his class. I'm really happy that my experience with the students yesterday as I was handing out the wellness kits, and this morning when I spent a little time in T-Rex, which is our fitness facility here on campus, students are masked, but more importantly, I think students are really excited to be back on campus, really excited to be in the classroom or to be online taking their classes. We know that there will continue to be challenges, technology challenges. It happens to all of us, but we want everyone to know that if there are technology challenges, we want to hear about it. Faculty can call one number, 974-9900, which will take them to the OIT hotline and they can get support there. But so far, I'm happy to report there are we have no reports of major disruptions. But if you're experiencing any kind of technological challenge, let us know. We're here to help to make sure that you can deliver the best instruction possible to your students.
So John, just let me ask you one question. I know people are looking around the country and seeing some universities that have gone back to what they did in the spring, send students home and gone online. Can you talk a little bit about our faculty's, the ability for a class to move from face-to-face to online to perhaps back to face-to-face? Can you talk a little bit about our preparations so that we don't really see ourselves at a point of that kind of decision? Everything's online. Can you talk about that?
Happy to do that. So our faculty, as you know, Chancellor, have been working throughout the summer in order to adapt their typical teaching practices to this new normal that the pandemic has forced upon us. And in doing that, they have built out their Canvas website. They've gotten used to Zoom. And I've already heard from some faculty, one faculty member who I just happened to run into 2 evenings ago, who said that she really wants to be in class to see her students and to meet her students. But if something happens, she is ready to switch to fully virtual, fully online instruction, and will switch back when a kind of all clear is given. So I really think that that there are lots of faculty on campus who want to be in the classrooms, but are also prepared to go back online. But we're not there yet. As you said, our faculty are remaining healthy. We have, as of today, as far as I can tell, just one faculty member who is self-isolating, or not self-isolating, but who has had a COVID positive test. And so our faculty are staying healthy. Our faculty are delivering their instruction, and but they're ready to adapt as circumstances require.
Thank you very much. So let's talk. I want to focus on contact tracing for the next 5 minutes or so. And we're really fortunate to have Dr. Brown with us. And Dr. Brown, I want to start by saying thank you for everything you've done over the last 5 months. You have showed up on a million panels. You've been an expert here, an expert there. People hungry for the knowledge that you have. So you've put in so many hours, and we really thank you. But could you start with sort of an overview? What is contact tracing? Why is it so important in something like this?
Sure, happy to do that. Contact tracing is one of our only means of control for this pandemic. We have the critical path is identifying people who are ill or positive, and then very quickly identifying those who may be at risk because of being in close contact with that positive case. All of that is very time dependent. And that's been one of the frustrations you mentioned earlier about the community awareness of taking 5 to 7 to 10, sometimes 14 days to get back a test results. Totally negates the whole premise and effectiveness of contact tracing. Contact tracing is only effective if we can respond very, very quickly. What this means is that when there's a positive case, and this is across the country, the world is using this method, this approach. And I will say we're totally integrated with the Knox County Health Department's effort to do contact tracing. We're a partner We are a subset, if you will, of the county, and we just brought a whole lot more people here. So we felt very important to establish this response. But once a person is positive, and that notification goes both to our own, if it's through the Student Health Center, we're aware of it, or if it's from an outside source, goes to Knox County. Once someone is positive, they are contacted by a contact tracer. There's a whole intake interview that involves identifying and providing contact information of close contacts. And then the contact tracers, and we have a cadre of contact tracers on campus, will make a contact, keep using the same word, but we'll reach out to those individuals who have been identified as having been in close proximity to that person. At that time, they will be given guidance, resources, how they need to self-isolate, what is available to them to support that, and time frame, as well as directions for testing.
Okay, so I know we've hired something like 20 contact tracers. Maybe Dr. Brown, either you or Dr. Gregg could say, so who are these people? How have they been trained? Who's in charge of that? So Dr. Brown?
Well, I remain as a consultant to the group. I'm very happy to say that we were able to establish and very quickly fill positions for a contact tracer coordinator. That person is I'm happy to say, graduate of the UT's MPH program. He's doing a fabulous job. We immediately as well established an associate position because we're running this 7 days a week, not 24 hours, but there are some support efforts around through the Student Health Center that are 24/7. We have hired a number of primarily graduate students, public health, social work, nursing. I don't want to leave out any groups, but those are the main ones that we reached out to, because of the likelihood that they already have some context of either the pandemic itself or those rather sensitive interviews that are sometimes have to be conducted. So it's an opportunity for vols to serve vols. And we have the ability to manage this very well within the campus infrastructure, primarily the Student Health Center. We will continue to, we established the program with the opportunity or the ability to scale up as needed. We will continually hire if we need more contact tracers.
So
we have established a very rigorous, excuse me, sorry.
No, keep going. No, that's good.
A rigorous training. It's all based on best practices and those that have been established through different resources, Johns Hopkins, CDC, our own Knox County Health Department. So we've totally aligned ourselves with those, with best practices around contact tracing.
The one other thing I was going to ask you is, if I get contacted by a contact tracer, what are they going to say? Are they going to call me? Are they going to email me? And then they start asking me questions. Is my information confidential? Could you speak about that?
Sure, and I'm going to share this with Dr. Gregg. Yes, you may get a call, and we really, really need you to respond and answer the call, whether you're faculty, staff, student, whoever, a community member, because you may be identified as a contact from another source out in the community. If you work somewhere else or engage with other groups, please take the calls. The questions may seem intrusive because they're asking for your close contacts, people you've been with, and their contact information. Yes, this is all confidential. This is not shared in a public forum. This is done with discretion, professionalism, and consideration for this very process, but it is the only way that we can contain the transmission of this infection.
So So I was speaking to this a little bit, the last time we did a briefing. We need students and everyone to cooperate when you get a call. And so Dr. Gregg, just a couple other things about contact tracing. Let's get to something important. How am I going to get something to eat when I'm self-isolating?
Well, we certainly took that into consideration. We didn't expect people to go without any food for 10 to 14 days. The contact tracers provide context of what's going to happen. What are the next steps that go beyond this initial interview that they've had? And I'd also say that we not only reach out by phone, but we also reach out by email and text. So we're not leaving any way of connection unattended there. But the contact tracer provides information. We get in touch with facility services. If a student's on campus and needs transport to our isolation housing, we're able to reach out to university housing that or Greek housing that assists us with also moving anyone that needs to move into quarantine or isolation. And then we also reach out to dining services, or we'll request that the student do so in order to go ahead and get their meal plan lined out for delivery.
So a couple other quick questions about if I'm in self-isolation, can I go to work? Can I go to classes?
No, what we're requesting is that anyone that's in self-isolation, quarantine, or isolation, that they do not attend work and that they do not attend in-person classes. Most of our students are asymptomatic who are positive, and most of our close contacts are as well. So for them to be able to attend classes virtually is totally fine as long as they feel up to it. If they don't, we have a dean of a student's office. There's a absence notification system that they can utilize to apprise their instructors that they may have to miss some classes.
So if I'm living on campus, why can't I just self-isolate in my dorm room? Why do I need to go somewhere else?
Well, most of our students are not living by themselves. Most of them have roommates. And so if we allowed you to quarantine or isolate in your own space, then there's the potential that you increase the risk of infection to the other students that are there. And so what we typically want to do is to move the student that we know is positive or close contact away from other students so it lessens the risk of other people being infected. Similar to what you do in your own home, where if somebody's sick, you kind of put them in their own room and give them their own bathroom and try to avoid as much close contact with them as you have to during that time frame.
Well, I really appreciate both of you talking to us about contact tracing. We'll probably continue to update about this topic on future calls because it's a new idea for all of us. Let me just circle back real quick to Provost Zomchick. Anything else on the academic side, the classroom side, before we kind of close this out today?
Yes, very quickly. And this is for any instructors or students who are on the call. If you're experiencing technological problems in the classroom, I have a new number for you to call. Write it down, 974-9110. That's 974-9110. I just got a text from our folks in IT. And if you call that number while you're in the classroom, they'll dispatch someone immediately to give you help. The 9900 number that I gave out earlier is for other kinds of technological problems. But the one that if you need help in the classroom right away, 974-9110. Thank you, Chancellor.
Thank you. You know, we're organizing these live briefings around the questions you all submit or that are submitted. And that's very helpful. So keep doing that. One last set of questions that we didn't address yet as we continue to be asked, what are the criteria we're using to make decisions? What would be the point at which we do something dramatic like some of these other universities have? And I think I've spoken to the issue about the classroom instruction. We feel everybody's prepared to move where the majority of what we're doing right now is strictly online. We still have not quite half of our classes with some face-to-face component. At the point at which faculty members feel the need to switch modes, they will and can do that. We will continue to look at things like positivity rates, our test capacity, just as Dr. Gregg talked about. We will look at isolation capacity. Right now, we're still only using, I think the number it showed on the website is something like 30 of our capacity, 250 rooms. We will also be looking at community data, hospital capacity, that kind of thing. So there's no one single metric, and we'll be monitoring it. All of that information is available on the COVID website. We've got asked a couple of questions about ventilation. Facilities Services has posted an updated memo to its website. You ought to go look at it, that you can find on how we do cleaning and disinfecting and what we've done about enhancing ventilation in some places on campus. So let me just close by saying I want to speak really directly now to students. And if they're not on the line, if parents are on this call, I hope you'll reiterate to them what I'm saying. First of all, I want to thank everyone for joining us. This COVID data will be updated every weekday, Monday through Friday, on the website. And there's a link to the data page on the main page of the COVID site. And we have our next regular update on Tuesday at 11:30. But before we close, I want to say this. I know this is hard. It's hard for all of us. And for our students, it's not what you expected. It's not what you wanted. It's not what anyone thinks of in terms of a college experience, but it's still a college experience. For our continuing students, I know it's not the experience you had last fall. It's not the experience you had in the spring. For our incoming freshmen, this is probably not at all what you envisioned, but I saw you moving in, and we have more incoming freshmen, and our enrollments are higher than we've ever been historically. So students want to be here. And I know it's not fair. I wish I could change it for you overnight. The only way to change this is for all of us to make some sacrifices and work together. And it is a sacrifice, and I recognize that. Wearing the mask it's hard to remember, but we're all experiencing, until we get through this, it's a loss, and it's not fair. But if we wear our mask, if we keep distancing, and if we put off the big partying for now, we will get through this. You know, I've read people say, kind of cynical people, I think, young people won't do it. College students won't do it. They will not stop partying. They will not adhere to the guidelines. We shouldn't trust them. I don't agree with that. I don't believe that. You know, history has shown the power of sacrifice for people your age over and over. I think of my dad, who couldn't wait to graduate from high school and volunteer for World War II. He graduated at age 17 and had to wait a whole year to join his older brother and all of his friends. I can't even imagine the sacrifice of my grandmother, her only 2 boys going off to war. The greatest generation was exactly your age. And generations your age have made sacrifices over the history of our civilization. I don't know about your whole generation, but I am betting on you. I'm betting on volunteers. You are volunteers. It's always been about leadership and service and sacrifice at this university. I'm counting on you. And I want us to prove everyone wrong. I think you can be, and I see many of you doing it right now, being a shining example. I believe in you, and I believe that together we will light the way for others. We can do this. We're all in it together. Be in it together with us. And thank you very much. And go Vols. It's Big Orange Friday.